Hi, everybody, and welcome in. It's time for another edition of WAJR's Ask the Experts. Thanks so much for being with us. I'm Tony Caridi, and today's Ask the Experts is being presented by the fine folks at HealthWorks Rehab and Fitness. And I am joined in studio by Dr. Chad Micucci and Mark Hose, physical therapist. And Chad is an orthopedic surgeon, and Mark is the head man at HealthWorks Blacksville location. Coming up on our program here today, we're going to talk about shoulder pain, and chances are, or at least the percentages are, that you either have, currently are, or unfortunately will suffer from shoulder pain at some point in our lives. How big of a chance of that? How about 70% of us? 70% of us at some point will experience pain in our shoulder. Guys, thanks so much for being with us. Let's jump in here and talk about the shoulder specifically as a joint. Fair statement that the shoulder is one of the most injured joints that we have on our bodies?
It is. It's one of those, it's a joint that is one of the most mobile ones. So that whenever we're trying to use it or we're trying to do different things, the thing is causing it can be injured more easily than other areas.
Yeah. Chad, when you look at a shoulder, and that's one of your areas of specialty, what from a biomechanical perspective, that it seems it's a pretty amazing joint when you pick it up in every different which way we can move it. What's going on there biomechanically?
Yeah, so sort of touching on a little what Mark said too, there's not a joint in our body that has the mobility, like you said, to do all the things we do with the upper extremity. So one of the issues also which allows us biomechanically to have the mobility is it's not a very constrained joint. And so a constrained joint sort of, if you think of the hip, you have ball and socket, the sockets are around the ball pretty much over the course of the entire circumference, so to speak. In the shoulder, the socket is actually flat, pretty close to being flat. So the ball sits on a flat surface, and so you think, well, how do we not just dislocate the shoulder all the time? And that's where the ligaments come into play, the capsule, and then the rotator cuff, which we'll talk about a little later on. All those things provide stability to the shoulder. So it's really a lot of soft tissue restraints versus more of a bony constraint. And I think that's where it leads to injuring those structures.
Big generalized question here. As people, are we fair to our shoulders, or do we treat our shoulders poorly in your view?
No, I think we abuse them immensely.
Why so, and how?
Well, I mean, we're very active. We try to be active individuals, so most times we're going to be using them. And when we're using our shoulders, and it's like with anything, we're probably not doing the best biomechanics. We're probably lifting too much. We're probably overdoing things. And over time, it's like anything else. It will start wearing out, or we'll do something and we'll feel that pain, and then we know we actually did something to it.
I would imagine computers have also impacted the stuff that we're seeing, right? Because computers lead to sitting. Sitting leads to head turning. Head turning leads to compensation. Are you starting to see that?
Sure. I mean, in my practice, again, I'd say probably 60 to 70% of my practice is shoulder pain. But in that, I find a lot of people with neck issues because of the referred pain, nerve impingement or pinched nerve in your neck, leading to shoulder pain or arm pain. So there's no question, computer use, ergonomics, how do you position the screen? How do you position your chair? What they call it texting neck now. So there's certainly some things with technology that are affecting the way we use them.
So many different things go into this joint. I'm going to throw out what's in there, and you kind of tell us how it all works. We've got a humerus, we've got a clavicle, we've got a scapula. Keep going. 4 different muscles all wrapped around it. What oftentimes goes awry, or is it equal distribution as to where problems begin and develop?
I think like what Dr. Micucci was saying too was we look at the posture and the biomechanics and everything with the bones, the shoulder complex, the rotator cuff, all the ligaments and everything else with this, they all have to work together. When we change the biomechanics, or we do things a little bit differently, what will happen is we start putting stresses on one of those areas, and one of those areas can fail.
As a result,
Yeah, so I think too, the shoulder again just goes back to being a very intricate joint. And so if you think of we call it the shoulder girdle, that does include all the structures you mentioned, the clavicle, the shoulder blade. And one of the important things, and Mark will attest to this because he sees it all the time with his patients, and when you're rehabbing the shoulder, you really have to work on what we call scapular mechanics. So again, it's posture, sitting up like I'm probably not doing right now, getting the shoulders back. And if you have good mechanics of the shoulder blade, it takes some stress off the rotator cuff and some of the other structures, allows us to use it in a better manner.
When we come back, we're going to start talking about specific ailments that come when the shoulder is suffering through an injury. We're going to talk about tendonitis, bursitis. We'll get into tears, rotator cuff, and all of that. These two gentlemen that you are hearing here today, Dr. Chad Micucci and Mark Hose, are going to be hosting a free public seminar that's coming up Wednesday night, October the 30th, beginning at 7 o'clock. Now, normally we do the HealthWorks for you on Thursdays, but obviously Halloween is going to be on the 31st of Thursday this year. And so one day before Wednesday, October the 30th, 7 o'clock, and it will take place at HealthWorks Maple Drive location here in Morgantown. No reservations are needed. It's absolutely free. And these guys will get into the specifics and literally can walk you through more information about shoulder pain. So do stay with us. We've got more coming up. Stay with us. Ask the Experts, being sponsored by HealthWorks, Rehab, and Fitness.